It's important to talk to your surgeon oncologist to see if you are a surgical candidate. Some folks that have extensive disease are not a surgical candidate, and they'll start with other treatment modalities such as radiation and chemotherapy. Comorbidities such as diabetes and heart, some lung conditions, the surgeon may tell you you're not a surgical candidate. Sometimes the cell type of your disease and the staging also drives if you are a candidate or not for surgery. Some of the surgeries performed for mesothelioma are a decortication. It is where they remove the lining of the lung, sometimes called a pleurectomy. There is a more extensive surgery called a pneumonectomy, and that is where they remove the whole lung. There are surgical interventions for the peritoneal mesotheliomas. Sometimes they will go in and do a resection of the damaged or diseased part of the intestine. There is a procedure called a HIPEC procedure where they go into the abdomen and they flood the abdomen with what's called a chemo wash. It is a more direct line and source of chemotherapy instead of the intravenous route. Your surgeon will explain to you all the components of the surgery, pre-surgery and post-surgery. They will tell you that you may have a chest tube. Many times surgeries, decortications, things like that will cause the lung to collapse. That's very normal. So they will tell you may have a chest tube in place to inflate or to keep that lung from collapsing. Post-surgery, it's all about the healing phase. It's all about pain control. It's about getting up and keeping your pneumonias down, getting up and being active. Post-surgery, sometimes the patient is sent home with a catheter in their pleura called a pleura catheter, where it continues to drain the fluid once the patient is at home. They will talk with him about good nutrition. They will talk with him about keeping their immune system strong so that the healing process, proceeds like it should.